President Biden has announced that all adults will be eligible for the vaccine by April 19th. But will we be protected from the new variants that are spreading in the Northeast? And are we opening up too fast and too soon? Should children be back in school now? Answers to these questions and more coming up next.
Live from Los Angeles, this is the Special Report.
More than 30 million people have had confirmed COVID infections, and more than 550,000 Americans have died. Several states are seeing a third wave. Some call it even a fourth wave. Yet many states are ending their mask mandates, they're fully reopening, and they're sending kids back to school. According to the New York Times, about 19% of the country is fully vaccinated, and 33% has had at least one dose. But will this be enough against new and deadlier variants? Here from my leadoff panelist, returning guest and vaccine expert, Dr. John Moore. You've seen him on a special report many times. He's a professor of microbiology and immunology at Weill Cornell Medical College, and he's, of course, a friend of the show. Good morning, Dr. Moore, and thanks so much for coming back and always being, so receptive to our ask. Your expertise is so needed. We thought we were really turning the corner, and it looks like there's some things happening in some states that may constitute what some are calling a fourth wave. Help us understand what's happening with COVID right now in some states, particularly those in the Northeast.
Yeah, I'm happy to be here, Areva. I always enjoy chatting to you and your audience. Well, is it a wave or are we having a blip? And it's too early to tell. There are definitely increases in COVID cases in the Northeast. In California, you're in a very quiet period, which is great. So what's driving this? Well, there are more transmissible variants going around. There's one that arose in the UK called B117 that we know is more transmissible. People are more likely to catch it. And we know it's more lethal, so you're more likely to finish up in hospital if you do contract it. So that is one factor. There's also a variant that was circulating in California called B1429. Now, that seems to have just died down a bit recently, which, is, again, a very good thing. So the variants are one factor that move cases up, but vaccination is increasing, which will move cases down. And then we have in between people's behavior. So if people have gone on spring break and whooped it up in Florida and brought the infections back to their states, that's a factor that increases cases. So you've got three things going on and they're pulling in opposite directions. What we've seen recently is an uptick in the number of infections. It's not the fourth wave at this point, and we hope we don't get there.
Help us understand, Dr. Moore, though, why states like New York, Michigan, Florida, Pennsylvania, New Jersey, it looks like, according to some report, those states account for almost 200,000 new cases in just 1 week. So why those particular states? Because I imagine people went on spring break here in California. They went to Palm Springs. They went to Malibu. So we also had lots of young people, on beaches with bikinis, without masks, I should say.
Yeah, you don't get a lot of kids on the beaches in bikinis in New York at this time of year, which is perhaps one reason. It's still pretty cold. And coronavirus is a seasonal virus. It will spread more in cold weather than warm weather. We know this. So that's one factor. People are not congregating in the same degree because of the weather that you see on the beaches and in the bars and in the streets in Palm Beach and Palm Springs. I mean, it's just a somewhat different dynamic. Plus, there is a variant going around in the Northeast that really is quite transmissible. And I think that's driving a lot of the cases that we're seeing. Hopefully it doesn't have an impact in other parts of the country.
There are some reports, Dr. Moore, about youth sports. I'm sure you've seen these reports that have come out that say maybe it's, young people getting back into organized sports that's driving this spike. Do you think that's a valid, conclusion?
Well, it's not one single factor, but some of these variants, like the B117 UK variant, they're thought to be more infectious for children. Now, there's not a lot of information on this yet, but there are enough case reports or examples of younger people, not just children, but younger people getting infected that we are somewhat surprised by. So that's perhaps a factor. I mean, if you're playing baseball out of doors, that's not really likely to be a high transmission event. I mean, I play an outdoor sport. I don't feel vulnerable in that situation. Perhaps if you're playing basketball indoors, it's a somewhat different dynamic. So again, there's no simple one-factor answer to all of this. It's human behavior, virus variants, and the beneficial effect of more and more people getting vaccinated, and now we're moving down into younger adults gradually.
Yeah, I want to ask you about herd immunity. We've heard a lot about it. You can't turn on the television and, hear one of the experts that work with the Biden team, they talk a lot about herd immunity. And we know that close to 19% of the country has gotten both shots, and at least 3 or so percent have gotten at least one shot. Are we getting closer to herd immunity?
It's a numbers game. The more people that are fully protected, add that to the number of people who've recovered from COVID, which gives you substantial protection, about 80% protection from reinfection. You add those numbers together and you start to get into 30% of America that is not susceptible anymore. But we need to do better than that. We need to get to something like 70%. So best estimates are by the end of the summer, sometime, August, July, that kind of time period, enough Americans could be vaccinated to get us to that point. But there's a lot of people refusing to be vaccinated, and that is the wild card here now.
Well, we know Biden has really expedited his timeline. He came into office, he said 100 million shots in 100 days. He blew past that goal, and then he upped it to 200 million. He's, likely blown through that. He said everyone that wanted a shot would be able to get it in May. Now he's moved that up to April 19th, which is literally like, almost 10, 12 days from now. So given that anybody, no matter what their age, what their, prior health condition is, can get a vaccine, does that, how quickly is that going to help us get to this herd immunity, given that, in 2 weeks, people can just walk up to their pharmacy, they can walk to a stadium, they can walk to a vaccine site and get the shot?
Well, everyone will have access to it if they choose to take it. I was chatting to a physician this afternoon. He said that a few weeks ago, people were clamoring at his door to get the vaccine. Now the pace is slowing because most of his population, his patient community, have already gotten it. So people who were desperate to get it are already vaccinated. Now we're going to run into people who are desperate not to get it because they refuse to acknowledge the realities of COVID. And they're the same people who refuse to wear masks. And it's concentrated among Republican voters, unfortunately.
Yeah, I'm glad you mentioned that, because I am hearing actually for the first time of people, I'm getting emails from organizations saying we're doing a vaccine clinic and we can't, meet our daily goals. We want to give 1,000 shots, but we only were able to give out 300. People are begging for people to come. So let's talk about this whole notion of Republicans. At first there was this focus on vaccine hesitancy, focused primarily on African-American communities, talking about our historical, issues with the medical community, Tuskegee, and all of these reasons why African-Americans weren't, willing, or at that point, or at least had some hesitancy. Now we're learning that like 30% of Republicans are saying they don't want the shot. And one of the reasons that they're saying, there's the political reason, but some are saying they're worried about side effects. Help us understand this notion of side effects.
There's always concerns about side effects. All human beings have concerns about any medicine that they're going to take. We all want surety that we're taking something that's safe and effective. And there's enough evidence now that the approved vaccines in America are very safe and highly effective. But people are still nervous, and you deal with the nervous people almost one-on-one or in small groups, and you talk to them and you educate them and you reason with them and you answer their questions. But then there's the MAGA crowd, for want of a better word, the people who refuse to wear masks, who don't accept that COVID is real, who look upon it as a restriction on their personal freedom. Live free or die. Well, for some people, it becomes live free and die, because they're taking risks, and they're taking risks not just themselves, but with their family, their friends, and in the end, the rest of us, because a large population of unvaccinated people allows the virus still to circulate and to drive new mutants and to keep the pandemic going. So they're actually being counterproductive. They all want the pandemic to end so that the businesses can open, they can all party again, they can live their life without constraints, but they won't do what is necessary to help make that happen. And we're all responsible for ending this pandemic. So we hear about, vaccine passports, which would be instituted by corporate America. The government will not institute vaccine passports. It would be too politically difficult. But if you want to get on a plane or go on a cruise, companies are entitled to ask you to pay attention to the rules they put in place. You can be thrown out of a bar if you go in without wearing a shirt, or if you wear sandals as dress codes. It's no different. Companies can institute these policies. But if you listen to Fox News, it's the greatest threat to the freedom of America that in the history of the world. I mean, it's amazingly hyperbolic language. Look, and it gives you, and yet they're all about choice. You have a choice. You want to get on a plane, take the vaccine, get a vaccine passport. Otherwise, drive from New York to California. That's your choice.
Yeah, we saw some of those same arguments, Dr. Moore, being made with respect to masks, as you said.
Sure.
I have the freedom not to wear a mask, and I had to remind people, the government regulates so many aspects of our lives in this country. You get in a car, if you don't put that seatbelt on and you're caught by a police officer, guess what? You're getting a ticket. If you go past the speed limit that's posted, guess what? You're going to get a ticket. You're going to get a fine. You could even end up in jail. So this notion that we have all of these just unfettered rights as Americans is just, wrong-headed. We live in a civilized society, and that civilization, that freedom comes with responsibility and a price.
Absolutely, it does. You can't go into a bar smoking a cigarette.
Yes.
You can't go into near a school smoking a cigarette. You can't enter my medical school if you're not wearing a mask. These are rules based on common sense and public health. But for these refuseniks, they're major impositions on their personal freedom. Well, freedom is an interesting concept because we live in a complicated society. You have to respect the rest of the people and their freedom to continue living.
Yeah, let's talk a little, though, Dr. Moore, about these variants. You mentioned them at the beginning. There's one in California. There's a variant moving in the Northeast. Some people are worried that even if I get the vaccine, will the vaccine be effective against this variant? And I know, I had the Pfizer shot, and I'm reading some things that suggest I may have to get a booster shot. I got it in January, so am I going to have to get a booster come July or August? Tell us what we need to be thinking about as it relates to the length that vaccines are going to be effective. Is it a year? Is it 6 months? Do we know yet?
Well, we're pretty sure it's at least 6 months. We're only generating data now on the immune responses 6 to 8 months after the first trials. So we haven't had a year, so we can't tell you about a year. But it's not just going to fizzle away. It would be gradual. And yes, it's worse that the vaccine and public health communities are planning for the possibility of an additional booster later this year, perhaps, but we're not there yet, and people should not be concerned about this. And as to the variants, the most commonly spreading variant, this UK B117, we are pretty confident that it will not impact the efficacy of these vaccines. There is a variant that arose in Brazil, and there's another one that arose in South Africa that do give us grounds for concern, because they do have a degree of resistance to vaccine immunity. We don't know how much to be concerned, and fortunately, they're not spreading that widely, these other Brazil and South African variants. So they're on our radar screens, and there are new vaccine designs in trials now to counter them. So we've seen them, we've planned for them, we've made new vaccine designs, they're being tested, and if we need them, they'll get rolled out. So unlike last year, we didn't have time to plan. This time last year, it was panic. Now we know what we're doing. I mean, the people who are making the vaccines know what they're doing, and we have time to plan.
Dr. Moore, I had someone say to me that they had gotten the 2-shot Moderna, but now they were thinking of getting a Johnson & Johnson shot.
I've heard this. Well, firstly, you won't be allowed to unless you try and game the system and cheat somehow.
Okay.
So it's not permitted by the FDA, and any vaccine site would refuse to do that unless you've tried to dupe them, and I wouldn't want people to do that.
Right.
So and there's no evidence that that would actually do anything beneficial for you. So I just would not go there. I don't think it's necessary, and I don't think it should happen.
Last question for you. It's about mask wearing. Do you envision sometime this summer when we are, as Biden said, in our backyards at these 4th of July barbecues, do you envision a world, in the United States where we go back to going outside without masks? Is that going to happen, you think, this summer, or is that still a year off?
It's possible when you have a group of fully vaccinated people all together in someone's backyard. I would have no problem taking my mask off in that situation. But people are people are pretty used to it. I was on the New York subway on Saturday and the Staten Island ferry going out to a sports event I was playing in. Everyone was wearing masks. The discipline around the city was just completely 100%. You did not see anyone who wasn't wearing a mask. So it may be controversial in parts of California, but in New York City, this is what people do. And no one is querying it, not in the communities that I've seen. But, masks work. I mean, think about this. We did not have a flu season this year. No one, very few people got flu. And they didn't get flu because mask wearing prevents flu virus transmission. So there was a bonus, a welcome bonus, and that proves just how effective masks are. We didn't have a flu season. That's great.
That is great. And we know certain Asian countries that, wearing masks is very much a part of their daily lives. So I guess the message to all of us is, 1, get the vaccine come April 19th or before if you're eligible. And 2, don't stop masking until the CDC changes its guidelines.
Well, look, this pandemic isn't over. Everyone wants it to be over, but the wish is not the father of the thought here. It's not over yet. And it would be pretty sad to be one of the last few people who die of COVID when victory is in sight. Let's just keep discipline, common sense, do the right thing for a few more months. Give the vaccines the maximum amount of time to fully kick in and encourage people to take the vaccine. There's so much infuriating nonsense going on at the moment. And yet, if we don't all get fully vaccinated, this virus is going to linger. We're going to be having this conversation in a year's time, and that would be sad.
Well, you got to leave it there, Dr. Moore. I love it. You said, just do the right thing. There's a famous movie Spike Lee made with that title. So those of you that love your movies, it's applicable in that context as well as in this context. So thank you again so much, Dr. Moore, for sitting down with me. Thanks for always encouraging us to do the right thing.
It's a pleasure. Good night.
My next guest is the Senior Director of Policy for Public Health Advocates. She is also an epidemiologist. She's a friend of the show, and I'm so glad to have her with us this morning. Her name is Dr. Flojaune Cofer. Good morning, Dr. Cofer. How are you?
I'm doing well. How are you?
I am great. So much is happening with COVID. I was just talking to Dr. Moore earlier in the show about turning the corner. It looks like we are on one hand, but yet we continue to see these cases rise. So I want to ask you about this policy that's being floated at the White House. And I think from what I've read, some of the Biden COVID advisors are maybe toying with the idea of changing the vaccine strategy to really focus on some of those states that are seeing surges like Michigan and New York, New Jersey, some of those states in the Northeast. Do you think that's a right approach? Is that what the experts should be thinking about in terms of the vaccines and getting them to those states?
from the beginning, we've always talked about, making sure that the people who are most in need are able to receive a vaccine. And so that is incredibly important to the strategy, is making sure that we have vaccine available where people are at risk. The important thing to remember, though, is that a virus doesn't know borders, and it doesn't know the difference between these state lines, right? Similarly, we're having the same conversation about the entire world, right? The whole planet has an at-risk population. And so when the vaccine distribution isn't focused on equity more broadly, we end up in situations where across borders that are often open and fluid, there is a major difference in who is able to access a vaccine and who isn't. So yes, it obviously makes sense to be able to think about who is in most need, who's at highest risk, where are those cases continuing to surge. It's also important that we recognize that just because we have artificial boundaries doesn't mean those are going to necessarily be the most meaningful boundaries in thinking about who needs access.
Well, you and I have had some conversations on the show about equity. We've had conversations about, the African American, Latino communities, underserved communities. Do you think where we are at this moment in time in April, the Biden administration coming in January, do you feel like more resources for both testing and vaccines have now been, directed to minority communities?
I think more have been directed. I don't think we've done enough. So we are still in a situation where many of the communities that need ongoing testing, right? Because everybody doesn't have access to a vaccine yet. And one of my major concerns has been that once we started on the vaccine, we shifted the same resources that were working on testing to vaccine distribution. And so we lost some of the key testing centers. And it felt like we downplayed the importance of getting a COVID test after we started focusing on the vaccine. And that's not the way we should be thinking about this. We actually should have been thinking about co-locating services and increasing capacity so people already knew where to go to get a test. And now that should be the same place they can also go to get their vaccine. And so there are some challenges to the way that we've approached this, but we absolutely have not gotten to the place where we have enough in communities. And there's still a lot of confusion around when can I go and get a vaccine and who is eligible. In California, one of our challenges has been that we have this phase and tier system. And so it's like all the phases are one. So it's phase 1A and 1B, but phase 1A has 3 sub-tiers. So, and then phase 1B has 2 tiers, right? And it's like, nobody knows that. And I've been joking and saying to people, we have a way to be able to talk about phases. They're called numbers. And we know that 1 comes before 2, comes before 3, comes before 4, and comes before 5. And if you just tell people, hey, we'll get to phase 5 in May, people can say, okay, right? And you can also have people sign up so they can be notified when we get to that phase. But unfortunately, we didn't put some of those things in place. And so we really have suffered in the vaccine rollout. And we've seen major equity issues in our Black, our Latino, and our Indigenous communities because of that.
What you just said, on one hand, seems so intuitive, but obviously it didn't happen that way. I'm sitting here as a person that does a lot, around logistics and the jobs that I have. And it would have made so much sense to have, one-stop shop. You come here for your test, you go next door for your vaccine, and they're all co-located, as you said, so that people know where to go. And you're right, because I don't hear people talking about testing, and we definitely don't hear much about tracing. It's almost as if that concept, we learned it early on in the pandemic and hardly hear anything about doing any contact tracing. I do want to ask you, though, about African Americans, particularly around this hesitancy. Spent a lot of time early in the pandemic, or particularly when the vaccine was rolled out, talking about, our relationship with the U.S. health system and the distrust and the issues that Black people in particular had around getting the vaccine. Do you feel like those hesitancy issues are starting to wane? And are you seeing more African Americans being willing to take one of the 3 vaccines that are out on the market?
Yes. And so that's actually really promising news. And, when we first were doing the polling, it was late in 2020, and not a lot was known about the vaccine. In fact, when the polling started, the vaccine wasn't even yet available. And so people were rightly, responding with their skepticism. They were saying, I'm not sure about this. And, how did they get it so fast? And when those questions were answered, a lot of people became more comfortable with, getting a vaccine. And so what we're seeing now is that only about about a quarter of Black Americans are what we would consider to be hesitant about the vaccine, which is reasonable. In fact, the demographic that we're seeing is most unlikely and most unwilling to get a vaccine is actually white Republican men. Over half of them are still saying no, even though there's a lot more information out there. And so some of that has to do with, some people were rightly skeptical from the outset, right? You have early adopters, even in technology. You have the people who, when the iPhone first came out, were the first ones to have it. And then you have people 5 years later going, all right, I guess I'll get rid of my flip phone, right? And so we need to be, we're okay with it when it comes to technology. We need to be also, accepting of it here. And also remembering that these vaccines, normally none of us would have access to it yet unless we were part of the clinical trial. That the reason we all have access is because we're in an emergency, and this vaccine has been determined to be much better than doing nothing, and safe enough that it's not going to cause the same harm that we're experiencing from the virus. And so that's why we're making it available. And so what a lot of people just wanted to know was, is this safe? Does this make sense for me? Is it okay for me to have? What are the side effects? And once those were known, and once more people's peers and family members and friends started getting vaccinated, and people started seeing that, it wasn't causing major harm, then people became more comfortable with it, which is exactly what we'd expect. Not everybody's going to want to start out holding a computer in their hand, but over time, you see your friend have one, you see they can do cool things with it, and you say to yourself, maybe it's not so bad, maybe that would be good for me too.
Yeah, no, and consistent with that, I was talking to Dr. Moore earlier in the show about this vaccine passports. Some states are talking about it. Lots of private businesses are talking about requiring it for you to come into a restaurant, to take a plane, to go on a cruise. The governor of Florida came out with a directive saying absolutely positively not. Prohibiting businesses in the state of Florida from using a passport system. What are you thinking about passports? And I'll just let you know what I've been thinking. Part of me thinks it's good. I'm fully vaccinated. My family's fully vaccinated. Everybody I hang around mostly is. But I think about equity there too. And I wonder if a passport system will create a two-tier system, and if, the normal people who fall to the bottom, Black and brown people, if somehow our communities will be disadvantaged by a passport system. Help me think about that in the right way from a medical standpoint, and definitely from an equity standpoint.
So I want to start by saying I understand why people are thinking a passport makes sense, right? Because we've always had travel vaccines, and there are places like you can't go to Nigeria, for example, without getting yellow fever vaccine. If you're from outside, you just can't get in. You have to have it. So I think we're accustomed to that. And so I think that's why, even though the name of it has been a vaccine passport, I think the challenge with it is, the vaccines are not yet approved, and so fully approved by the FDA. They are under emergency use authorization, as I previously mentioned. And so until something is fully approved, I think it's incredibly premature for us to start talking about denying people access to something that's not even fully approved by the FDA. That's first and foremost. Secondly, though, there are some populations, right? As much as the vaccine is safe for most people, one size fits most, not all. And so there are going to be people who, for a variety of reasons, are unable to be vaccinated. Right now, those people include people under the age of 16. So what you're saying, if you say a restaurant is only going to allow vaccinated people in, is that I can go, but I can't bring children with me, right? That doesn't quite make sense. The other part of it is that, and I think I mentioned this on the show before, when it came to the clinical trials, we didn't have pregnant and lactating women in the clinical trials. We don't yet know the efficacy for people who are immune compromised. And so we are also creating a situation where we could be creating a two-tier system, not just with who has access to the vaccine or who has been able to be vaccinated, but also a two-tier system with what is your health status. And that's inherently discriminatory. I would never want to live in a place where people, because of their health status or because of a condition that they may not want to have to disclose to you, are now unable to access basic services. And so I think we are not only way too early in this to be having this conversation, but also I think there are far too many key considerations for it to be a viable option.
Yeah, and as a lawyer, I'm sitting here thinking of all the lawsuits that are going to be filed when businesses start using them for some of the reasons you just stated. Like, I'm not, my medical history prevents me from getting vaccinated. I shouldn't be denied access to your cruise or, to your flight or to your restaurant simply because I can't participate in a vaccine that's not really available to me because of my status, my health status. I think there are a lot of issues. Obviously, I'm with you on that. It sounds good in theory, but when you start thinking through the different layers, you can see all the problems that are created, with equity, with, access, with fairness, and so many other issues. I want to talk to you now, though, about opening up. So Texas Rangers, outside of Dallas, the big stadium, hosted a game just last week. 40,000 people, mostly unmasked people, at this baseball game. Is that dangerous when you see that as an epidemiologist? Do you get nervous thinking, wait a minute, we're not there yet?
Yes, that's the first thing I think is I know the weather is warming up in a lot of places, and I know some people have been vaccinated and they're feeling good and they're, anxious to get back to the life we used to live without thinking much about it. But it is premature. One of the things we know is that keeping the most restrictive of protections in place for slightly longer can really help us to be able to get to a place where we actually flatten the curve and we get to a place where enough people have been vaccinated that we don't actually start to see spikes again in the future. And so that's really important in terms of a strategy. The other piece of this, and it ties back into the conversation we just had, is that a vaccine is still not a panacea, right? And so there still will be people who get sick. We know that lots of people have gotten a first dose of a vaccine, but they haven't gotten the second, and you're not fully immunized until at least 2 weeks after the second dose. So when I see large crowds of people getting together, being maskless, and attending an event, I think to myself, this potentially runs the risk of being a super spreader event where lots of people can get sick, and recognizing that it certainly decreases the likelihood of getting sick once you've been vaccinated, but it doesn't eliminate it. And so I just like to remind people of that as well, that we don't want to put too much in the way of, trust and reliance on the vaccine without also recognizing that there are other precautions, especially right now, that we still need to engage in.
Well, you and I both are in California, and according to our governor, I think it's June 15th or so, it's going to be like California is open for business, and that's indoor restaurants, indoor theaters, venues for comedy, for music, just about anything you can imagine. It sounds like it's California pre-COVID. What should we, be concerned about, those of us that live in California and even other states like Florida that have been open for a while? What should people be doing in these states?
Well, for one, I think we really should consider the age-old adage of just because you can do it doesn't mean you necessarily should do it. And so just because things are open doesn't mean that means you should run out and start, engaging in all of these activities. So that's the first part. I think the other thing is, my personal opinion, given what given the data I have access to and just given what I know about this, is that I would much rather us be in a situation where we were deciding on June 15th what the reopen plan might be, as opposed to committing ourselves at the beginning of April to reopening in June, not knowing what is to come in the next few months. Personally, I think it is really, when we do these things prematurely, I think it harms people more than it helps, because in the very early days of the pandemic, we were saying to people, oh, it's just going to be 2 weeks. Oh, it's just going to be a month. Oh, it's going to be June. And we kept giving people these this light at the end of the tunnel and then shutting it off. And I think that's really damaging to people because they don't have an opportunity to actually be able to plan out, what does it mean? I need to get a real chair because I'm working at home permanently. I can't just sit on the couch anymore, and just really commit to it. And so that's what I'm concerned about here, is that we're committing to a date, largely for political reasons, because there's a lot of political pressure on California to reopen as the 6th largest economy, in the world. And then all of a sudden now we're committed to this path, even if the data don't say that that's the safest way to move forward.
Yeah, and I guess one thing we have to take into consideration is that there's some, reports out that some of these vaccines are only effective up to 6 months. So if you got the vaccine like I did in January, that means June, July, if as California is opening up, if I haven't gotten a booster, does that mean I'm protected? Those are questions that I don't hear, our public health officials talking about, is that timing of, there are many people who got vaccinated in the early months that that, might be in danger come June, July, if it's determined by research that we do need a booster. So something to think about. Last question before I let you go. So many of us who have been vaccinated are ready to be safe with other vaccinated people. The CDC says if we're with other vaccinated people, we can, take our mask off. We can, have small gatherings. But there are lots of us who are in families, who have, friends who have decided for whatever reason they're not going to get the vaccine at this point. Do you have any words of wisdom, advice to help folks who are trying to navigate, these, it could be very political, even, and family dynamics that are happening around this whole vaccination, rollout, and who's gotten it, who hasn't gotten it, who can come to the barbecue, who can't come to the barbecue. Those are going to be big questions for 4th of July. Biden says go out there and have a barbecue, but people will be like, well, wait a minute, are you vaccinated? So how do we sort all of that out?
Yeah, I mean, it's a really important question to ask and to try to answer. The first thing is that I always say, it's much better for us not to take the approach of trying to convince people of things, especially adults. Adults don't take kindly to that. And so it's likely not an effective strategy either. What makes a little more sense is to ask, what are your concerns? Because the big thing is that we want people to have informed consent. And what I find is that we focus so much on getting them to the yes that we actually are not focusing on the informed part. And what my experience has been is that when people have said, well, I'm not sure about, and then I ask them questions, one of the big questions that's come up that nobody has asked is, well, does this cost money? And the answer is, oh, goodness, no, it's free. But a lot of people don't know that. And so there were a number of people who in the early days were saying, I don't want the vaccine because they were thinking, I can't afford it. And it's not a high enough priority for me to put it in my budget, or I just don't have a budget to even put it in, right? Yeah. And so that's an important thing, is to identify what is the concern. Because a lot of times there are pieces of information that can be shared that can help to allay that concern. Or sometimes they have legitimate concerns. I'm planning to become pregnant in the next couple of months, or I'm not sure if I am already, and I'm not sure, if this is safe. And those are legitimate concerns that we should affirm. I think the other thing is to find, COVID safe activities that everybody can enjoy. So with the weather warming up, it's great to be able to have that backyard barbecue and to require everyone to wear a mask. Honestly, if we're outside and masks are being worn, that's a pretty safe activity as long as you can kind of try to keep distance between you. It's the indoor gatherings that we saw around Thanksgiving and Christmas that are really ramping up the transmission. And so again, that's an option, right, that you can have to be able to affirm maybe some mixed status families where some people are vaccinated and some people aren't.
Yeah, I'm gonna think about that. I don't know. I gotta get my head around these folks who are saying, I don't have enough information. Hello, have you been under a rock? It's like some
people haven't been paying attention, right? Like, you and I have been paying a lot closer attention to all of the developments that have been happening over time. And then I sometimes forget because of what I do. And then I had a conversation with someone and they were saying, so now there's one, or are there two vaccines? Who made them? And I'm like, Pfizer and Moderna feel like, household names. They feel like the names of my two pets, right? But for other people, this is very new and they haven't been tracking it as closely. And so just recognizing that some of us are deeply steeped in reading every headline, and other people are like, I know there's a pandemic, I know it's contagious and I should wear a mask. I don't know much else. And so that's where we're starting with them.
That is such an excellent point. We get in our bubbles, right? Whether it's a political bubble, or in this case, a vaccine bubble, and we forget not everybody, as you said, is reading every headline. Not everybody's watching the special report like they should be, because if they've been watching, they would have met you. They would have had all this great information from you, Dr. Moore, and all the great experts that we've had on the show. But I'm going to exercise some patience. I'm going to send folks some links. I'm going to send them, this video, your interview, and recognize that not everybody is paying as close attention as some of us are. But I want to thank you again. Always Just such a pleasure to sit down with you. You're one of my favorites. You're like the best in the business. Always good, clear, simple information for people to understand. I think that's another thing. People get really confused. Sometimes you can watch all these different doctors on these shows and they're using big words and they're using terms you haven't heard, and it gets very confusing. And, you know, we got to give it to people like fifth graders, because with everything we have going on in our busy lives, we don't have time often to sit down and read complex medical information. So thank you for keeping it simple and keeping it real, because that's what people are going to relate to. Again, thank you so much, Doctor. Good to see you.
Absolutely. Thank you so much. I try to keep it simple because I remind people all the time, I still don't know what the economy is. So when people are explaining to me what's happening with the economy, I need them to keep it simple for me. So I try to do the same when I'm explaining. We all have our wheelhouse. And so it's really helpful if we remind ourselves, you know, that everybody may not know as much about this as you do. And it's important to keep it simple. So thank you for that. I really try hard. And it's always a pleasure to be on the show. Have me back anytime.
Fantastic job. Definitely, we'll be calling on you because this virus is not going anywhere.
It's not.
Thank you so much. Joining me next is a nurse and advocate for nurses' safety. Her name is Maria Gaytan. Also joining us is physician and scientist, Dr. Sheila Young. She has been leading the effort in Los Angeles in testing and vaccinations. And joining us is middle school special education assistant who has over 10 years working with children with all ages and disabilities. So I want to welcome to the show, Juwairiah Syed. Thank you, ladies, for joining me this morning. You know, we have been hearing all these headlines about schools reopening because positivity rates of COVID are down in so many communities. We know in Los Angeles, one of the biggest school districts in the country, kids are getting ready to go back to school in the next week or so. How are you feeling about that, Dr. Young? You are out there on the front line doing vaccinations, doing testing. Do you think a big school district like LAUSD is ready to welcome kids back on campus?
Definitely not, especially because many of the kids who would be most at risk or their families haven't been vaccinated yet. And so the kids themselves, as we know and as we've said before, will get over the illness generally pretty easily if they get infected. However, they can still carry the virus and pass it on to someone else. So this was the thing that happened in the beginning of the pandemic, pushing so that our school districts would close down again, because so much of our community lives in multi-generational households. Now, I know that this is not the case for kids who might be in private school, kids who, you know, don't have families with grandparents or aunts and uncles living there. But for a very, very large portion of our community in Los Angeles, this is the case. Mm-hmm. And multiple families are also living together. So that even puts more people at risk. So can we not wait another 2 or 3 months till we get more people vaccinated?
Yeah. Juwairiah, we know we saw a lot of wrangling between school districts and unions and staff around, you know, are these classrooms safe to go in, not just for the kids and their families at home that Dr. Young is talking about, but for the staff. So you work in a school, in a special education setting. Are you back on campus at this time?
Yes, I am back on campus. I just wanted to make a quick clarification. My name is pronounced Juwairiah.
Oh, I'm sorry. Okay.
But yes, so I am back on campus. I thankfully am vaccinated, but I know that there are still teachers who are expected to come back on campus who have not been able to get their vaccines yet. The district has tried to rally to get vaccines available for staff, but coming back on campus, it still feels too soon.
So do you, tell us what a classroom looks like? Because when we think about kids and masks and social distancing, we think, oh my God, how can you get a 7-year-old or a 10-year-old, and particularly a kid with special needs, to wear a mask all day and to stay, 3 feet or 4 feet away from their peers? Is that happening?
They are trying their best, but it is very difficult, especially for the part of just wearing the mask. For a lot of the children with special needs, They have sensory issues, and so a lot of them have a hard time having something over their nose the whole time. And so we have to remind them constantly to keep their mask above their nose, and also making sure that we maintain our distance. It is helpful in one way to be able to actually work with them in person, because online obviously has its own challenges, but in person, it's the fear and the threat of the virus or any other illness really spreading right now. And it's just, you got a job to do, so I have to go in person right now.
Yeah.
But if I had the option to stay home, I would rather choose that, because I don't feel that the school districts are ready to be able to come back fully.
Is there a policy at your school that teachers have to be vaccinated? Kids to get into kindergarten have to be able to show their vaccination records. Is there something similar happening with regards to the adult staff in schools?
No, to my knowledge, they're not actually allowed to ask what your vaccination status is. Mm-hmm. But I know that they are trying to help those who want the vaccine to get their vaccine. There are some staff who I know it's also difficult because they have their own health issues, which may result in them not being able to get the vaccine. So one of the teachers that I'm actually supposed to work with later on, actually, because of her own health, is not able to get the vaccine. But that's also a difficult situation to be in, because at this point, you don't really want to be around people that don't have the vaccine, because I myself am immunocompromised.
Yeah, it's a really difficult decision. I want to bring you into the conversation, Maria. You are a nurse. And you're an advocate for other nurses. We've seen a drop in hospitalizations as a result of the numbers that are coming down in terms of infections. But are you feeling as a nurse that we're turning a corner, and how are nurses feeling in this moment?
My personal opinion is that I believe reopening that soon is going to cause a wave that's going to peak back up. That's my personal opinion, because we still have not reached the level of immunization to reach herd immunity that we need to subside to put in under control the pandemic, specifically in LA County, where we were in the red for such a long time. Now, also LA County, where I work, in the emergency rooms, we already had social disparity, social determinants of health and health inequities that's going to predispose families that are multi-generational, like Dr. Young said, into a situation that might put them at a peak risk. And children are not getting immunized. There's no immunization for children yet. So what are we doing? And if we get children to get that sick, it could change. Maybe the children are responding very fairly now. If they catch COVID, they bounce back soon. But it can turn the corner and affect them differently. So if we proceed with opening the county, we should remind and be aware of maintaining social distancing and keeping your mask on. We are still not going to be off the hook. Us per se, we can't let our guard down. It is. I worked on the weekend in the ER, and we still had a nice amount of a pretty good amount of COVID patients coming in. Even though we came out of the contingency care level, we went back to the conventional care, we still have a number of COVID patients checking into the emergency rooms. So we have to be conscious that even though for the economy, it may be okay to reopen, we have to maintain awareness for safety.
Yeah.
And prevention is the number one thing. We still have to do good hand hygiene, wearing our mask, and maintaining social distance, because this was going to protect you. And, like she said, the vaccine is recommended, but it's not mandated. So there's still a lot of people out there that do not want to get it for whatever reasons. Everyone has choice.
Well,
But still,
hold on a second, Marie. I want to bring Dr. Young back into this conversation because there was a story that's really disturbing. A community outside of Chicago in Illinois where there was an outbreak at a bar. And because of this outbreak at the bar, Dr. Young, it impacted the school in that community, and the school had to close down. Do you think public health officials and elected officials are getting the connection between what happens in the community and what happens in schools?
I think they do. However, I also know that they have a lot of political pressure, lobbyists, lots of deep pockets who are pushing for things to open up again. And again, we have to understand that we've all got to survive this.
yes.
And we've got to think about the health of everyone. So what I feel is that those who've gotten vaccinated, they're feeling good, they're feeling fine, they're feeling maybe invincible. But just because those who had access and had resources and inside connections to get a vaccine doesn't mean that we should open it back up because other people haven't. There are so many people who want to get vaccinated in South Los Angeles. We haven't been able to meet the demand.
Yes.
You know, we're doing on-site registration. We didn't implement the My Turn system, and we just can't meet the demand. So the rhetoric that Black and brown people don't want to get vaccinated, yeah, there are one or two, and you'll hear those voices a lot. But there's also many people who want to get vaccinated. The other thing I want to say is we can't be so quick to forget that it was only, a month and a half ago that all of our hospitals were completely full. That we didn't have enough room, that we were, working really hard, working with our state assembly members and senators and, really pushing that we needed more resources, especially for our county hospitals, for even some of our small private community hospitals, because we were not prepared for what happened. Let me tell you this. Oh, go ahead.
No, I was going to ask you, if a parent is trying to make a decision, they've gotten a letter from their school district, whether they're in California, New York, or whatever state they're in, and the school is decided to, have on-campus, in-person instruction. Would you advise that parent to send their child to school?
No, and I've actually had the same thing happen with my child. My child actually, she goes to a private school. 1 week she's with her dad, and so he actually took her to school without my knowledge. So those things are happening. And it's not okay because I have a son who is on immunosuppressant medication. And so, very, very cautious about him. When you ask, am I afraid? Am I being on the front lines? No, because I wear my mask. I make sure I wear my mask. I make sure I'm away from people. I talked to her principal, and her principal essentially said, well, we've read all the articles, we are doing everything we can, and, the kids should be in school. And we, had a lively discussion about that. But I just said, I do not feel that this is the time. The South African variant is here. The Moderna vaccine is 6-fold less effective on the South African variant. This is from their own website. So we have to understand that. And the way that these vaccines are being made, they're not being made in a way that allows the body to have multiple antibodies to multiple parts of the virus. So one of the things that we have seen is that there was a study in Europe that demonstrated that kids have an antibody to the conserved portion of the virus. So there's a portion that doesn't change, and there's a portion that changes. So kids have that, and that's likely why they're not showing signs of getting infected as much. But nevertheless, the adults don't have that conserved portion, and those who've gotten the vaccine do not have that conserved portion. So if they're exposed to a different type of coronavirus, they could still have a pretty bad outcome. And so we've heard that the UK variant spreads more easily. We've heard the same thing for the South African variant. So we really have to keep that in mind. And we can't reopen because we have not gotten this pandemic under control.
Yeah, I just want to ask you one last question, Maria. What do you say to someone in your workplace or in your community that, not about the vaccine, because we understand there are lots of health reasons why some people may not get a vaccine, and we've got to allow people to, feel comfortable to get it when they, feel like it's the right time for them. But about the mask wearing? The evidence about masking, even double masking, is pretty clear. What do you say to people when you go out into the community or you go to work and people aren't wearing masks? How does that make you feel, and what do you say to them?
Well, I have to remind them to put the mask on, and just remember that you don't want to be in the bed where you're going to have to get intubated. You never want to do that, because COVID likes diabetic patients. COVID likes immunosuppressed patients. COVID likes patients that already have respiratory comorbidities that is going to put them at risk. And your lungs go to capacity and you'll stop breathing, and we will have to intubate you, and you may not make it. So keep your mask on and wear it properly over your nose. Yeah. Over your nose, cover your nose and cover your mouth, because it really makes a difference if you only cover your mouth and you're breathing everything that's out there. It really makes a difference. You're not helping yourself. I understand it gets annoying, but it is worse to see someone trying to breathe and fight for their lives the last minutes and have no one at the bedside to be with them, or die alone. That's the worst feeling ever. As a nurse, as a daughter, and as a mother. Now, for parents that don't want to send their kids to school, there were affidavits that were out there. If you say you don't want your child to go to school, you can opt out, and you could have kept your child at home. Both of my kids, two of them, my nephew and my younger son, I checked off. Their school is opening back up. Elementary schools are opening up in our district, but I decided that they are not going back to school. And they said, why everyone else gets to go back to school? I said, no, because you're safer at home. For me, I believe you're safer at home for now. But it is a parent's choice, and I understand that some single parents need to get out there and work, and they need those 8 hours while their kids are in school so they can go and work. I understand it's a lot, like I said, social determinants of health that impact some of those parents' decisions and some of the economy, but let's remain cautious. Again, I cannot emphasize that. And we do need more resources. We do need more resources for our county so that we can get everyone immunized. The demand is high.
That's a great point. I want to give the last word to the teacher. You've been, sitting there patiently. You're in the classroom. For those parents that are sending them back, what words of advice would you give us?
I would say to just make sure to really, obviously, wear your mask. All the kids need to have hand sanitizer with them. They need to understand why they're social distancing from their friends, because especially working with children with special needs, sometimes they may not understand what is actually going on around them. And as a parent, it's your job to make sure that they understand what is happening, because it can definitely impact your own child. We just had a student at our school who tested positive. And one of the things that I've noticed from working with children who have special needs is that it's so hard for them to keep their distance from one another, because, especially if they've been in groups together for years and now they're being told to separate. They don't get why they're doing this. Right. Some of them may understand it, and it is extremely helpful, but the biggest thing is just making sure that your kids, whether they have special needs or not, making sure they understand what is happening, and if they are going back to school, what that means for them, because going back to school does not mean going back to normal. And I don't think we should go back to normal right now.
No, we got to leave it there, ladies. Thank you so much for your time. Thank you for your information. So valuable. Obviously, I think your point is well taken. We are not going back to normal. We've got to be vigilant. We've got to be cautious, and we've got to protect our own families, our own communities. So again, thank you, ladies, for joining me this morning.
Thank you for having us.
All right. Thanks to all of my guests for joining me this morning, and thanks to you for being a part of the special report today. Who knows where we are going to be a year from now? But the good news is we are turning the corner on COVID. And those of us who have been locked in the house for the last 11 months, we've been following the CDC guidelines. Hope. There is hope. There is hope. Don't give up hope. Despite the fact that there may be some states that are seeing surges, you've heard Dr. Moore, you heard Dr. Cofer say that we are getting closer and closer to that herd immunity, and we are getting closer to being able to resume, maybe not what we think of as our normal lives, but we're able to turn the corner as it relates to this pandemic. Now, some words to live by before I get out. Patience is the companion of wisdom, AKA COVID was real and COVID is real. People, don't screw this up by rushing to open things up. Don't ignore the CDC guidelines about wearing not one mask, but 2 masks and socially distancing. Also, don't get caught up in the misinformation about vaccines. Talk to the experts, talk to your doctors, get educated on the 3 vaccines that are available and get vaccinated as soon as you can. And then encourage your family, encourage your friends, encourage your coworkers. Be patient, give them space, but do encourage people in your immediate circle to get vaccinated. And please don't ever forget 500,000 people, 500,000 plus have lost their lives as a result of this pandemic. We owe it to these individuals. We owe it to their memories to get this right this time around. So in the words of my grandmother, remember, a hard head makes a soft behind. I'm out, y'all. Wear your mask. Be safe out there. Remember, we are all in this together.